Okay, as we don't have that much time, I think we will kick off. So let me introduce Rubbia Ali, who is an Aziz scholar. She's currently completing a 3-year doctorate in clinical psychology, training to be a clinical psychologist. Just allowing people in as I read this. Right, she holds previous postgraduate studies, which includes an MSc in Psychiatric Research and in clinical and in cultural psychology and psychiatry. Okay, her current research focuses on mental health inequalities for refugees and asylum seekers. She has worked both nationally and internationally within the mental health sector for close to a decade. Right? And she's also currently pursuing a certificate in classical Arabic and Islamic sciences. All right, and hence we have this topic, Islamic history and psychology. She's going to give us an introduction to maybe the worldview of both civilizations. Okay, Rubbia, it's all over to you.
Great, thank you so much. Assalamu alaikum, everyone. Hope you're all well, inshallah. So this talk will last around 25 minutes and then hopefully like 15 minutes for any questions. I won't go into this. This was just a bit about me. But yeah, currently completing my doctorate at King's. And I guess the reason why I felt like this topic's really important is because of how, as I progressed through academia, I sort of started to realize how Eurocentric academia really is and how much knowledge has not been made accessible to us because of this, and especially regarding sort of Islamic traditions and those from Islamic communities and what they've contributed to different fields. So I wanted to just kickstart, I think, for the next few slides, just to discuss generally what mental health is, some common conditions, and then from there go on to discussing a little bit about academia, how Eurocentric it can be, and what this means for us as students, sort of studying within like Western institutions, and then sort of relating that to the field of psychology. How that's impacted the field currently, and then also now then going to touch on to Islamic civilizations and what they've contributed to the field and why we don't hear much about this. So just generally, I provided the World Health Organization, the definition of mental health. I felt like it was important because I think sometimes language around this topic has been infiltrated by maybe stigma or maybe by a lot of misunderstandings, especially with the rise of sort of like pop psychology online and on social media. So generally, one's mental health is just a state of well-being where an individual recognizes their own abilities and is able to cope with the normal stresses of life, work productively and fruitfully, and is able to make a contribution to their community. So mental health in of itself, as just those two words, is just a state of being, the same with sort of like spiritual health and the same with physical health. When it comes to sort of the work I do, etc., and therapists, it starts to look at those who maybe mental health is sort of declining. Now, I think everyone can relate to sort of having or experiencing distress in some way. And so we'd reference that as mental health distress. And then we would sort of clinically diagnose when it gets to a point where it's starting to then impact a person's functioning, their day-to-day, and it's sort of been impacting them for a long period of time. So that's where we move on to sort of common mental health conditions and struggles that I sort of wanted to touch upon. So anxiety and mood disorders being one. Now, again, just to emphasize, I think we all experience anxiety at some point. Even me, before doing this talk, I'll have an experience of anxiety, but generally it can just push us to sort of follow on to do the action, and it can be quite a helpful emotion. And the same with, for example, low mood, grief. Those are normal emotions that Allah has created for us to experience. I guess, again, it comes into sort of a disorder when it starts to then impact daily functioning. So eating, sleeping, sort of socializing, going to school, going to work. That's when it then becomes a condition where professional help might be needed. And then we have different sort of disorders, including eating disorders. So bulimia, anorexia, and disordered eating in general. And then OCD, so obsessive compulsive disorder. Again, this is probably one that many are familiar with or have heard terminology around. It's generally when you experience intrusive thought, and from that, there's a need to relieve that thought by following out an action, and that thought cannot be relieved without that specific action. There is also a term called scrupulosity. The reason why I wanted to bring that topic up specifically is because it references OCD within a religious framework. So for those who experience OCD when it comes to forms of worship or ibadah, so what that might look like is a person who has been diagnosed with OCD, and the OCD coming out in sort of wudu, so maybe repetitively feeling like you need to do wudu because you haven't done it correctly. And now when that gets to a point where people are starting to sort of repeat it 5 to 6 to 7 times, and the same with sort of prayer as well, someone constantly repeating the prayer, believing that they're not doing it correctly when actually that's in the context of sort of starting to have sort of obsessive thoughts around it and needing to sort of do it again because of those thoughts. So that's what we would class as scrupulosity. And then another one, oh, sorry about the numbers, but the next one I want to talk about is psychosis. That in itself is not a disorder. It's more a sort of a symptom or an experience. That's why I referenced it as an umbrella term. And someone can be diagnosed, for example, with schizophrenia and have psychotic tendencies, and someone could be diagnosed with depression and might have experiences of psychosis too. So it can really vary. But at its core, psychosis is generally holding beliefs or experiencing the world in a way that's not the norm in the specific culture or context that they're in. And then I also wanted to add on a bit about non-clinical, because I think, again, the burnout, stress, trauma, anxiety, and low mood is something that I think generally human population experiences in a variety of different ways from day to day due to a variety of different things. So yeah, that was like a whistle-stop tour just around sort of common terminology around this topic. But what I really wanted to emphasize on now is going more deeper into Islamic contribution within this field and why we don't hear much about such. So there's quite a lot of information on this slide, but I'll try to break it down. Before I narrow in to psychology just generally, I think it's really important to acknowledge Eurocentrism in academia and how this is sort of a colonial legacy that's really shaped how we learn, especially within Western institutions. So universities at their core remain deeply Eurocentric in the curriculum. So what that means is they often center sort of European scholars, European philosophers, scientists, and theorists, while underrepresenting or not sharing scholars and contributions from the global south. So when I reference the global south, I mean sort of anywhere that isn't Europe or America. So many academic disciplines, not just clinical psychology, but even if we're thinking about law, if we're thinking about sort of social sciences, etc., they continue to frame knowledge through a very Western lens, and they limit engagement with sort of like indigenous and sort of non-European knowledge systems. So they frame European thought as the foundation of human knowledge and often really tend to overlook centuries of intellectual traditions from other parts of the world. So we even see that research methodologies are often based on Western paradigms, and this might not be appropriate for studying non-Western societies and cultural contexts. I'll explain what that looks more like going forward when I talk about sort of specific disorders or specific interventions that clinical psychologists use at the moment. And even if we think about sort of the publishing industry, which of course controls much of academic discourse, when we're all writing, for example, papers, or when we're studying, or when we're going on Google Scholar, or when we're going on PubMed, etc., there is a huge bias towards those who have not just who are not just sort of racialized as white, but also those who work in Western institutions. So I think there was a stat to showcase that those from non-Western settings are up to 3 times more likely not to get their work published. So you see how it sort of dominates knowledge production and where we're getting knowledge from. And I think this was just extremely important to sort of point out that there's huge disparities, and it then privileges sort of knowledge being shared out from Western societies as opposed to sort of like global South societies. And that's not due to the fact that that isn't inherent within other societies. It's just that due to colonialism, Europe and sort of the US have the monopoly on knowledge production and how that's being spread. And that sort of gets set then as the default. So now I'm going to specify it, the sort of Western psychology and its historical role in colonialism and oppression. So when I said that I was going to operationalize it, when we think about the fact that Western knowledge is sort of seen as the default, we negate and neglect a lot of input from the rest of the world. And we also see how this field specifically has been used historically within colonialism as a tool to oppress others. So this is just a few things that I wanted to point out in the history of psychology within like Western settings. So IQ testing, I don't know if anyone's sort of familiar with them, but they actually were originally developed to rank races and justify eugenics, which was essentially a very racist pseudoscience that sort of emphasized that the white race is supreme, and they showcased this through bias testing that was favored towards white people to showcase that brown and black people are not smart enough. Then we have something called the DSM, which is a diagnostic manual, which has the different conditions and diagnoses I've just mentioned. So depression, schizophrenia, anxiety, etc. Now, within this book, a few centuries ago, there was a term called drapetomania, and that was used as and referenced as a mental health condition. And they labeled this, so it was a very sort of like a racist, a white psychologist created this sort of mental health condition as a way to prevent sort of those who were enslaved from Black background in the US from escaping slavery. So they would start to pathologize and say, and use psychology and psychiatry as a means to continue to allow slaves to be kept. And they would say to those who were slaves that wanted to leave, it's because you have a mental health condition. So you can see how it was sort of weaponized to oppress. And again, sort of the pathologization just generally of even within the subcontinent. So within India, Pakistan, Bangladesh, when the British were there, they used to utilize psychology and psychiatry as a means to say, look, these people are extremely primitive. They do not have the ability to govern themselves. They are not sort of mentally well, and use that as an excuse to justify sort of colonialism and the really, really disgusting sort of attitudes and behavior that were then inflicted. And we see that even now in current day in the context of Palestine. So the reason why I wanted to bring this up is to show sort of just how dangerous it is to know that sort of colonialism has not only sort of silenced a lot of the other global majority and their contributions, but also how violent it has been historically as well. And again, at the bottom, I've just shared that today these legacies still remain because we see that generally, within the UK, Black men are up to 4 times more likely to be sectioned under the Mental Health Act, which again is a legacy of sort of these racist attitudes. And also when racialized patients, so someone who's Black or brown comes to sort of mental health services, they're more likely to be offered medication as opposed to talking therapies, because there are inherent stereotypes and beliefs and biases that those from racialized backgrounds are unable to engage in psychological treatment. So that's sort of like an overview there. So now I want to sort of touch on the Islamic perspective and Islamic history, because I've sort of showcased, okay, why we're not hearing much about it, why we haven't heard much about it. So I want to dive in a bit deeper to share the rich history that we have, because for those who don't know, the first documented psychiatric hospital in the world was founded in Baghdad, Iraq, and was inspired by Islamic literature around for every disease, there is a cure / treatment, and that sort of encouraged Islamic thought and Islamic scholars at the time to find these treatments and find different ways to support those experiencing different conditions. So I want to bring up to you a great woman of Islam, Rubbia al-Islamiyah. So Rubbia al-Islamiyah, may Allah be pleased with her, she was born in Medina, and she's actually widely recognized as the first female nurse and surgeon from the Islamic world. So she's trained under her father, Saad al-Islami, and he was a physician, and so she gained a lot of expertise in medical care, and she really played sort of a huge and pivotal role during the Islamic period. So here I've put into more detail sort of what she contributed. But essentially during the Battle of the Trench, Rubbia established a sort of medical tent adjacent to the Prophet Muhammad ﷺ's mosque in Medina. And here she sort of treated wounded soldiers. So this sort of initiative that she took on is actually been considered one of the earliest forms of organized mobile care units in the Islamic world. And it was these efforts that in part led the groundwork for the development of the hospitals that I've just mentioned. And these were hospitals that were spread all over the Islamic world. I'm going to expand on them in a moment. but she played a huge role in sort of training other women in medicine and nursing. She laid the foundations for around like holistic healing because she really emphasized in the care that she was given around hygiene, patient care, and mental well-being, and showcasing compassion as a clinician when you're providing that care. Now, despite sort of her pioneering contributions, her legacy remains sort of under-recognized in mainstream sort of historical narratives. And in contrast, you might hear more about figures like Florence Nightingale, even though she emerged sort of centuries later. They're sort of celebrated as pioneers of nursing for all the reasons that I've just sort of mentioned, as opposed to sort of this woman who contributed a great deal towards these psychiatric hospitals within the Muslim world. So, Bimaristan is what these hospitals were called. So in Farsi and Urdu, Bimar means ill and Stan means land. So it was basically summarized as the place of the sick, essentially. And then in Arabic, it was referenced as Dar al-Shifa. Now, these were a huge global advancement for their time. So again, they were the first documented psychiatric hospitals in the world. And in contrast to sort of contemporary European practices, where at that time, places in Europe believed that it was due to it being demonic and due to supernatural causes, these hospitals actually approached mental health with a compassionate and scientific perspective. So patients with mental health conditions were referred to these hospitals, and they were actually provided with treatments such as medicinal music therapy, baths, and what we would consider now as talking therapies, aiming to sort of restore balance and well-being. And this humane approach was rooted in the Islamic view that mental health was a psychological/medical condition requiring appropriate care rather than a manifestation of moral or spiritual failings, which a lot of the rest of the world at that time had viewed it as. And it was incredible. And I was able to visit one actually in Turkey recently. It's still there, kept as a museum. What's incredible about them is it goes so far beyond just the treatments that they offered. Something that's really beautiful, and you see it all across sort of the Islamic world, is the architecture. And when we think of sort of psychiatric hospitals in current day, I think we have a certain view of them, especially from even horror movies or what we've heard of them and what we've seen of them, sort of almost prison-like institutions. But the design of Bimaristans reflected a huge understanding of the therapeutic benefits of environment on mental health. So they often featured abundant light, fresh air, and flowing water, and they really tried to create an atmosphere that was conducive to healing. So essentially, they had separate wards, and they were for mental health specifically, and they were actually a nearby masjids to encourage people to go and visit the sick, and to not hide it from society. So here we know currently there are very, very rampant sort of stigmatizing attitudes towards mental health if someone's been sectioned, etc. But actually during this era, these hospitals were put beside the masjid, and it encouraged people to go and visit the sick, whether that was a physical health condition someone was experiencing or a mental health condition. And just a few sort of figures that I wanted to touch on, that I think were really important and significant, and played really, really huge contributions to the field that often get overlooked also. So I want to introduce you to Al-Balaki. I've put in the corner, I hope you can see, maybe if you want to take a picture, but it's a research paper that you can sort of read more on about this specific person that I'm going to mention. But essentially, Al-Balaki was a Persian polymath whose work significantly advanced sort of early understandings of mental health. So he was born in what would be considered as modern-day Afghanistan, and he was educated in Baghdad under the philosopher Al-Kindi. So he wrote this book you see here, and it's called The Sustenance of the Soul. And this book has been particularly notable for its holistic approach to health. So this, by the way, was written centuries ago. So in this text, Al-Balkhi emphasized sort of the interconnectedness of the body and the soul, arguing that both physical and mental well-being are interconnected, which is something now that actually Western psychology is starting to understand more. Before, they really did separate these two out. But again, from sort of its innovation, these hospitals have viewed them as sort of interconnected. He also, Al-Balkhi, identified and described various mental health conditions such as anxiety, depression, and phobias, and also proposed methods for their treatment. So his insights and his understanding between psychological and physical health was really leading for his time. And his contributions include sort of understanding how thoughts can impact behavior. And this is something considered now as CBT, so cognitive behavioral therapy, which is seen as like the gold standard treatment for anxiety and depression, and is often attributed to a scholar called Beck, who sort of researched this more around 50 years ago. However, here we see within this very text that al-Balkhi has been discussing this sort of centuries ago, but due to all the factors I mentioned before in terms of who gets the monopoly of knowledge and spreading that, al-Balkhi sort of contributions get sort of put under the rug as such and not spoken about as much. And then I'm going to mention someone called Al-Razi. So Al-Razi, again, was a Persian polymath, and he was a director of a hospital in Baghdad. Again, in the corner, there's a paper there if you'd like to read more on it. But he was incredible because he introduced something called psychiatric aftercare. Now, this is something that we hear about that's happening more often. But again, centuries ago, it's something that he was already investing in. So when a patient would be discharged from a hospital due to experiencing a mental health condition, the hospital that he was governing and sort of directing would provide the patient with 3 gold dinars. And these 3 gold dinars were basically aimed at supporting the patient integrate back into society, as they knew that, you know, a person's socioeconomic status can have a huge impact on their well-being, feeling like low mood, etc. Of course, money makes a huge difference to how regarding how you experience the world. So even from centuries ago, there was that thought about, okay, once the person has now left hospital, what are we going to do to support them so they do not relapse? And that's something, to be honest, that the field generally in current day is really failing at. So the fact that this was sort of practiced all these centuries ago showcases how the approach then towards patient care was really one of compassion and very, very holistic, thinking about how all the different areas of a person's life can impact their well-being. And last but not least, and one that I'm sure many are familiar with, I thought I'd mention Ibn Sina. Again, was a polymath, so was an expert in various different fields, and he made significant contributions across medicine, philosophy, and psychology. So he wrote something called the Canon of Medicine, and this is what is in the corner, and this served as a fundamental sort of medical text in both the Islamic world and Europe for several centuries. And in the realm of mental health, his sort of understanding was particularly advanced for his time. He again recognized the importance of psychological well-being and provided detailed descriptions of various mental health disorders. He also discussed what we'd reference now as dementia, and he discussed sort of what we'd now reference as depression as well, and explored again sort of the mind-body relationship, and how important it is sort of that all these different areas of one's life can impact our well-being. So that was sort of a whistle-stop tour, sort of summarizing the contributions that were made. There is so much more. I wanted to put this slide on to sort of showcase then the legacy of colonialism and why we don't really sort of understand or have knowledge about this, is that when Europe then started to sort of colonize and invade Muslim land, when you're colonizing, you're not just stripping, and you know, you're not just stripping the land of their resources in terms of physically or materialistically, but also in terms of attitudes, etc. So where stigma now is quite rampant in certain communities, that wasn't always the case. It's not to say that it never existed. I think stigma has existed for as long as mental health conditions have existed. But the increase in that, in part, is due to the legacy of colonialism and those sort of attitudes towards mental health being spread from Europe once colonizing, which is why it's really ironic now that you see it pitched being differently. But yeah, I then also just provided, I share more on my Instagram around this topic in case anyone's interested. But yeah, that was sort of like a whistle-stop tour on it. I thought I'd try to leave like 10 minutes for questions, so I'll stop sharing. And if anyone has any questions, do let me know. I did speak really fast as well. So yeah, let me know if there's any questions at all, inshallah.
Brilliant. Thanks a lot, Rubbia, for that. There's awful lot to take in there. I think there are some questions in the chat, so I might just sort of just go through them first. I think some questions, maybe some comments. So I think when you talk about colonialism and its legacy, I think someone's noted here, medication for schizophrenia was marketed towards angry black men who involved in the civil rights movement in the 1960s. So
Yeah,
yeah.
There's a talk on it I can also send, but it's racial trauma and psychosis. So it's exactly what was shared. They would start to, during the civil rights movement, when they didn't want those who were enslaved to have like freedom, etc. They didn't just limit it through sort of Jim Crow laws, etc. They tried to find different ways, and another way was to pathologize, and so you see an increase in schizophrenia diagnosis being given to specifically Black men, and the fact that these mental health institutions were also segregated based on a racialization as well, even as far back as early, sorry, as the 1960s.
Okay, and another question is, could you explain holistic medication in Islamic for mental health and what correlation body acceptance with antidepressants during depression? Does it work? I heard depressed people get more depressed during medicine.
I think it's really hard to give a sort of generic answer to this because it does tailor person by person. Um, so as a psychologist, I wouldn't prescribe any medication. Mine solely focused on therapy, but I have seen for patients, it just depends on the person. Sometimes a combination of both will work. Sometimes just talking therapy will work. Sometimes medication will work. So it just really depends on a case by case. The gold standard in the UK is to try sort of talking therapy first, and then if it's persistent, they will then try antidepressants.
Okay, dementia happens to normal people and high performance people like surgeons. Why? Any insights from Islamic
Yeah,
history?
so I'm at my current placement. I'm actually in an older adult inpatient service for dementia. So essentially, those whose dementia has now caused them to be unsafe, maybe in the community, they'll come to hospital, and there really isn't too much information as to why and who gets dementia. They have seen risk factors, so for example, stress, high blood pressure, etc. But there isn't sort of a clear-cut answer as to why and who it can really impact and affect all types of populations.
Okay, and the final question in the chat is when anxiety and depression affects your job or daily activities, especially when something's happened in your personal life, what would you recommend is needed Islamically?
I would say the Islamic approach, and something I didn't really get to touch on too much just because of for time, is that it takes a very holistic approach. So it's looking at spiritual, physical, and mental. So I think it's trying to work on all three of those. I think if it has gotten to a point where it's really impacting your day-to-day functioning, then seeking professional help is a part of Islamic tradition and advocating for it, as that would be sort of what's inclusive of treatment slash cure in the hadith about seeking that out. So I think if you've tried other things and that hasn't worked, then professional help would be appropriate if it's impacting you in such a way.
Have you come across any places in the Muslim world which are using the traditional way, as you outlined, this sort of holistic approach where people are using maybe music or maybe using architecture or these other therapies? You know,
Yeah, different parts of
yeah.
Turkey are. And I would, if anyone is interested, there's a city in the west of Turkey. I think I'm going to butcher the name, but I think it's called Edirne, and that's where I went. And you sort of see these sorts of hospitals and how they operated. But I think where a lot of this knowledge was not there, it's only now up and coming for a lot of sort of communities to start looking into. And I would really recommend reading from Rania Awad. So she has something called the first Muslim mental health lab in Stanford University, and she's a psychiatrist by trade, but also studied sort of Islamic studies as well. And she's done a lot to sort of uncover and find a lot of this literature and sort of publish it in the English language.
Um, Feel free to ask any questions if anyone's got any. You can unmute yourself, I think, and ask. Um,
So,
other sort of logistical questions I'll answer.
so according to what we learned at undergrad, some psychological issues are incurable, but the symptoms can be reduced. How do you incorporate Islam with this? So even sort of hearing there's different interpretations of the word. When the word cure is used, they also do slash treatment. So I think from that lens, there's the opinion that, well, sort of which is aligns to what you're saying in the question, that not necessarily cure as such, but a treatment to sort of reduce the symptoms. Um, I think that's all the questions in the chat. And again, feel free. I've put my Instagram, so it's like mindfulness. If a question does pop up, you can also just like send one there. I'm more than happy to answer because I know that was a lot of information to take in, and then I can forward the slides maybe after in case anyone wants them to read more into.
Yeah. Just wondering, in Europe in the Middle Ages, I mean, you mentioned Ibn Sina and Razi and Balkhi, I think. So were their writings or their treatments then transferred over? Were they used in Europe in the Middle Ages? Those kind of treatments of mental health?
Ibn Sina especially, yes. I think there was a lot more sort of influence and texts were used. But I just don't think we're made to know that because then when it's like we're repackaged and retaught them through European scholars who might have expanded on them or incorporated them into their respective civilizations. But definitely they had a huge impact. Even hygiene practices, etc., that we use in the hospital, shared a lot of knowledge for Europe and how to sort of like incorporate those into their own. I mean, even it's difficult because even if you Google now, if you were to Google the oldest hospital, a psychiatric hospital in the world, the Bethlehem would come up, which is where I'm currently doing my placement. And yet that's just completely incorrect. So you see that, yeah, a lot of the time we just don't get taught these things or know these things because of how knowledge is being pitched to us.
Okay. We didn't really get a chance to ask you about the jinn question. I mean, I mean, how
And yeah,
maybe classically how they're differentiated between, of course, the magic and the jinn and that kind of stuff. Because that seems to be dominant in a lot of Muslim communities, especially in Europe, I suppose. That's a first recourse rather than maybe the scientific sort of mental health model.
yeah, and that never used to be the case. So like in this sort of era and in these hospitals, etc., they try to look at it from all different avenues. I do think, and obviously this could be a whole different topic, but there are more clear-cut signs of what that would look like, sort of like in terms of like jinn possession or jinn impact, as opposed to mental health conditions. But I think because there is a lack of psychoeducation or knowledge on what these mental health conditions will look like, the first gets priority. Um, and we talk about sort of stigma as well. I don't have it here, but there's something called Maslow's hierarchy of needs, and it's the triangle, and it shows how we need to what we need in order to function. So at the bottom, you see sort of like physical needs and physiological needs. And I think the reason why stigma is so rampant within sort of different communities that make up the Muslim community in the UK is because a lot of our forefathers were sort of escaping war, persecution, colonialism, poverty, etc., as a consequence of other countries coming into to their own. So when they're coming to this country and sort of trying to build, and they're met with systemic racism, they're met with automatically socio-economic disadvantages, their focus then generationally is just to ensure survival and just to ensure that physical needs are being met. So mental health then becomes sort of like a privilege to think about. And I think that's what sort of allows for then stigma to arise, because of course, I think at times having the privilege to think about your psychological well-being and when you're just focused on survival is really, really difficult. And I think that's sort of one of the reasons why it's so rampant.
Okay, brilliant for that. I mean, it's just, I mean, you've just sort of touched on it. So I think there's what we'll do is we'll share the slides and we'll share some further information for people. And if there's interest, maybe we can come back and focus on one particular aspect.
Definitely.
Good
Well,
talk.
thank you for listening.
No, brilliant. Thank you for that, and look forward to you publishing parts of your dissertation. I don't know if you should do articles or whether you just get qualified. I don't know how it works, but look forward to seeing more on this topic.
Inshallah, yeah, we'll share these once they're published.
Okay, brilliant. All right, thanks everyone for attending, and we will follow up with slides and further information. Thanks a lot, Rubbia. Thanks for that.
No problem. Take care. Assalamu
Okay,
alaikum.
take care. Assalamu alaikum, everyone.